Alright, so one of the things that a lot of people have experienced or unfortunately will experience in the fire profession is a back injury. And one of the things that gets kind of tensed up and spasmed on us is our multifidus, and that's due to a back injury. It just tightens up, we try to protect ourselves, and it's a really intrinsic muscle in that it just fires on its own. We don't really have to think about it. It's not something we can actively kind of engage, so when we take a step, it fires for us to stabilize our spine. But due to that injury, it may have turned off, or we just need to kind of reestablish that firing pattern. So one of the exercises is a multifidus activation exercise. So we're going to use a foam roller. You want to lay down, make sure your head is supported, and so is your sacrum. So this is going kind of right past your glutes here. And then what I want to do is try to find my ASIS, so kind of the top of my hip here, my hip bones, and I want to put my fingers right on the inside of that, and then I want to try to create some tension. So I want to try to put some tension against my fingers. I'm not pushing my stomach up. I'm trying to create tension, almost trying to pull kind of a drawstring between these here. So I create some tension there. I want to get my scapulas back, my shoulders and elbows kind of driven down towards my hips in a straight line to create some tension here. And then what I'm going to try to do, it's a very small movement. I'm going to bring my left leg up, just my heel off the ground, back down. Then I want to do the same thing with my right side without any weight transfer or any shift of my hips. So now I'm coming up with this leg, back down. All right, so creating that tension, keeping those ASIS, the deep pelvic floor muscles engaged there. We're going to bring the left leg up, back down, and then the right leg with very little shift, bring it up, back down. When you first do this, you're going to notice you're all over the place. You're twisting to one side, maybe your opposite hamstring's engaging, trying to keep you stable. But as you keep doing it, you're going to get better, and you're going to figure out what to stabilize and how in order to make that movement happen. And then the more you do it, the easier it gets when you start walking, when you do other core exercises, to just have that muscle engage.